Now, as you'll know, the coronavirus is causing concern the world over, but the World Health Organization has this message for us.
People had suddenly the impression that the virus was in the air, and everybody who go under this cloud of virus will be infected. So this is not the situation. Currently, the virus is transmitted through droplets, and you need a close contact to be infected.
No doubt the reaction to this virus has been considerable. The media, including the BBC, has given it extensive coverage. Many governments have acted decisively to restrict people arriving from China or bring their own people home. And today we had this update from the British Foreign Office saying it now recommends that British nationals who are able to leave China. So that is all British nationals in every part of China. It's also, though, useful to put the scale of this crisis in perspective. We noticed the US health journalist Liz Szabo saying, look, there have been 425 deaths from coronavirus all over the world. Meanwhile, 10,000 Americans have died from the flu this season, and flu season hasn't even peaked. Now, worldwide, flu kills over 600,000 people a year. There are up to 5 million cases of it each year. You could compare that to the roughly 20,000 cases of coronavirus at the moment. Yet, because of these cases, 22 countries have introduced trade and/or travel restrictions. Here's the World Health Organization on that.
Such restrictions can have the effect of increasing fear and stigma with little public health benefit.
And this is what China's representative told the WHO.
We believe overreaction. By adopting restriction, isolation, and blocking measures are not beneficial to international collaboration, and such measures may lead to more complicated outcome and interference on prevention and control efforts.
And certainly China's under pressure on a range of fronts. Taiwan has launched an extraordinary attack accusing the Chinese of failing to release up-to-date information. Have a listen.
We've seen the Chinese government rudely and unreasonably pressuring Taiwan on the international stage. They're putting political considerations over people's health and safety. This basically is extremely vile.
There's history here, of course. Taiwan's not a WHO member because of China's objections. And while Taiwan maintains its independence, Beijing considers it to be part of China. So every disagreement between the two has to be listened to with that in mind. Another aspect of this story is the illegal wildlife trade in China. The Politburo Standing Committee, this is the top political leadership in China, has now come out to say it's necessary to strengthen market supervision, resolutely ban and severely crack down on illegal wildlife markets and trade. Now, this is an issue because markets selling live animals are known to be a potential source of diseases that are new to humans. And the virus, which started in the city of Wuhan, well, there's speculation that it perhaps found its origin in this market in the city. Here's Navin Singh Khadka from BBC World Service on that.
So major international conservation organizations, what they're saying is China needs to cash in on this opportunity, this situation, and turn this temporary ban into a permanent one. Because as you know, China is the biggest consumer of wildlife products, both legal and illegal. It's been under tremendous pressure for quite some time now. Back in 2003, when we had the Sars outbreak, the Chinese government did put a temporary ban back then as well. But then within a few months, this business, wildlife business, came back, and then it was business as usual.
While China's leadership has admitted shortcomings and deficiencies in its response to this crisis, that's a rare admission, and the Politburo Standing Committee has said we must improve our national emergency management system and improve our abilities in handling urgent and dangerous tasks. Well, we know that some warnings were ignored or silenced. Let's focus on this doctor who was working at Wuhan Central Hospital. He noticed 7 cases that he thought looked like Sars. That's a virus that led to a global epidemic in 2003. And in December, he posted a warning about a potential outbreak in a chat group with fellow medics. Shortly afterwards, he was summoned by police and accused of making false statements and being told he'd severely disturbed the social order. He was then given this document to sign, and, well, most of it actually involved language from the authorities rather than from him. He was told, "We solemnly warn you, if you keep being stubborn with such impertinence and continue this illegal activity, you will be brought to justice. Is that understood?" Underneath it, Dr. Lee wrote, "Yes, I do." Well, from there, in January, officials in Wuhan were insisting that only those who came into contact with infected animals could catch this virus. That wasn't true. Also, no guidance was issued to protect doctors. And then Dr. Lee fell ill. But it wasn't until 10 days later, on the 20th of January, that China actually declared an emergency. By the end of January, Dr. Lee posted this picture with the words, "Finally diagnosed." He had the virus. Well, Stephanie Hegarty from BBC World Service has been looking into more details in his case.
He's still in isolation and he's in ICU, but he's able to text and he's been able to post on social media. Definitely not out of the woods, but he's doing okay.
And have there been sanctions for him sharing his diagnosis?
Well, the strange thing is that he's clearly had the confidence to share this story towards the end of January, and that may be because though he was disciplined by the local police, the central authority in Beijing then criticised the police for that move. So that appears to have given him the confidence to then start sharing his story, which is quite strange for doctors in Wuhan or doctors involved in this crisis. We haven't seen many of them speaking out, or any that have. Their posts have been taken down or deleted. This has been up for 4 or 5 days now.
Well, I was going to ask you about that. You've written extensively about this on the BBC News website. How easy is it to communicate with this doctor, or indeed any doctors in Wuhan?
It's not easy, and that's, I think Dr. Lee's case is a clear example of just how well China can control the narrative of this story. And they've been doing that, as I said, by deleting posts, by going to people's houses and telling them to be quiet, as we saw with Dr. Lee. And it's a very impressive control structure.
Now, you're a population specialist for the BBC World Service, and I wonder to what degree the changing nature of China's population and where it lives, more in cities, less in the countryside, is impacting on how China responds to this crisis.
Well, it's probably not a coincidence that this happened just as China was undertaking the biggest human migration in our history. There's an estimate of 3 billion trips taken over the case of 40 days. This happened bang slap in the middle of that while people were celebrating Chinese New Year. And one of the really important things in terms of locking it down was stopping people from moving, stopping people from returning back after the holidays.
That's easier said than done, though, presumably.
Yeah, for sure. And it's not just travel within China on trains and planes, but in the past 10 years we've seen global number of passengers taking airplanes double, and most of that growth is happening in China.